HealthCare and CVS's MinuteClinic expand in-network primary care across Connecticut, opening convenient same-day care, extended hours, and coordinated services at 20 CVS pharmacy locations statewide.
That's right. Joining us this morning live from CVS in Avon is Dr. Prem Kumar, president of the Hartford HealthCare Medical Group. Good morning to you, doctor.
Good morning.
Good morning.
Happy to be here.
We're happy to have you. It sounds very busy where you are in Avon. Tell us about what's happening right now. It sounds like an exciting time.
Absolutely. We're announcing a massive partnership between CVS MinuteClinic and Hartford HealthCare's clinically integrated network this morning. It expands primary care access across the state, more than 20 CVS locations. It truly is a huge differentiator for us. At our healthcare system, we believe we want to be a house of 1,000 doors, and this really is an expansion of what we want to do. And with partners at CVS, it really impacts every resident, and for us, it's access that's closer to home.
So what does this mean for patients?
Primary care is the core aspect of almost everyone's healthcare within the state. And we truly believe that expanding primary care improves healthcare outcomes such as chronic disease, lowering the cost of care, and above all, longitudinally keeping healthcare outcomes as best as possible. What this means is that starting now, you can have primary care access, same day, next day, have appointments, evenings, weekends, and weeknights, which truly expands the access to primary care across every county within the state of Connecticut.
And Dr. Prem Kumar, this is so important because I understand that there's some sort of a primary care shortage in our state. So how is this partnership going to help people get care faster?
I believe we're at a pivotal point in primary care here in the state. Demand is growing, access is tightening, and for us, being closer to people within the state is important. And shortages for physicians and advanced practitioners are being noticed by every healthcare system, including ours. We build locations across the state, and it's really, really hard to keep up with demand. But with partners like CVS and opening access to primary care across all of the various locations really allows us to tap into all the various access points and expands primary care beyond the brick and mortar walls that we have within HHC.
Absolutely, and I think a lot of times we are not so good about our health. We don't make those appointments. We don't go see our PCP. Do you think this is going to change how people treat health care, and hopefully we'll start seeing a primary care physician regularly?
That's the goal. The hope and goal is that as people build relationships with their primary care physicians, it does improve their overall health outcome, as I previously mentioned. And the more access to care that you have, you're not waiting on an appointment for 6 months, 9 months, or 12 months. It's access when you need it. And that truly is a game changer for us. And that should impact people's outcomes. People shouldn't be using emergency rooms and urgent cares to get true primary care. They should be using locations such as CVS and Hartford HealthCare in order to connect to their providers.
Yeah, that is a very good point, and I'm so glad you are creating an accessible way for people to get in touch with primary care. Dr. Prem Kumar, we really thank you for your time this morning.
Thank you.
Thank you.
Of course. We will be right back.